Welcome back to another episode of Uncensored Truth in Medicine. Today, I have a real treat for you. One of my favorite pediatricians out there. She is just bad to the bone. Dr. Angie Farella is a pediatrician down in the Houston area. She has been a leader in the COVID movement and a good friend of mine. So welcome, Dr. Farella.
Well, thanks for having me, Dr. James. It's always such a pleasure. We have such a good time on these.
Yes, we sure do. I want to start out, first of all, how many pairs of sparkly boots do you have?
Sadly, 2.
More than one.
Only 2.
Yes, she always wears the craziest, wildest boots, and we love it. So tell people, so I met you through COVID, so let's start there, and then we can go backwards and forwards and wherever we need to go. How did a pediatrician end up becoming a COVID frontline doctor and a warrior for all things good and righteous?
Well, basically it was not that unusual that I would treat patients. Basically in the entire United States, they just started shutting things down, as you know. And it was right around what our kids were going into spring break. And so I was actually kind of slowing down anyway. That week is always very slow in pediatrics just because everyone's going on vacation, no big deal. Mm-hmm. And all of a sudden, I started noticing that all the doctors and hospitals around me, outpatient clinics, were just closed down. And we were getting patient calls, not for the kids, but for the adults. And there was also another tragedy that happened in Lake Charles, Louisiana, which is about 2 hours from here. There was a horrible flooding incident. And so many of those people from Lake Charles were migrating into Houston. And so we started getting calls from my patients' families saying, our place is wiped out in Lake Charles. We're trying to reestablish here in Houston, but nothing's open. There's no outpatient care open right now except for urgent cares or ERs, and we need just refills on our medications. So it kind of started right there where I was just refilling people's everyday meds because they didn't have a physician to help them out. So I started there, and then I started getting calls from those same type of population, my patients' parents, relatives, things of that nature, when they started getting sick. And they're like, we're not going to the ER. We went to the urgent care. We got no help whatsoever. They told us to go home until we were blue. This is unacceptable. Will you please help us? Mm-hmm. And that was at that time that I just said, well, my doors have been open. We're not super busy. Sure, come on in. And that's literally where it started, is I just started to accept adult patients because they were sick patients and they needed to be cared for. That was it. It was pretty simple. Mm-hmm.
Yeah. Kind of just fell into doing the right thing. And I remember you told me around that time you were looking at this and said, this is just a virus and we can treat it. So you were really one of the first people that was on it with the early treatment drugs.
Absolutely. Back then, I look back because I'm kind of one of these people that just watch how cycles happen. I kind of watch history a little bit. And in 2017, we had a horrible flu A outbreak here locally. I was seeing 80 patients a day. It was insane. It was a true pandemic. It was Spanish flu. And I was running around like a chicken with my head cut off for a few weeks, literally, like nonstop. COVID comes around and it's crickets. Some people are not getting that sick. I'm like, this is a RNA virus, just like the influenza virus is an RNA virus. So there's lots of RNA viruses out there. And I figured, well, you know what? If flu treatment is Tamiflu, Zufloza, Amantadine, these are old-timey products that have been on the market forever. I figured, well, you know what? Let me start there. So in my little arsenal at the office, I just said, well, you know what I'm going to do? I'm just going to try to treat them with supportive treatment, budesonide, albuterol, breathing treatments, vitamin D, probiotics, multivitamin, things just to boost their immune system. And then I'm going to also not only support that, but I'm also going to try to treat them with an antiviral. Even Pepcid or Tagamet, I just added that if they had abdominal pain or something. And guess what? It worked. It was like Zufloza worked. So I was like, oh, okay, I'll just use this. Hydroxychloroquine came down the pike. I had quite a few of my patients, like grandparents on HCQ. And so I was like, great, if someone gets sick in the house, share your HCQ with them just temporarily if you can't get them in to see me, so it was kind of like this spreading of information issue. And, we made it through pretty unscathed. I mean, that first round really wasn't that bad. The first person I treated was a mom of one of my patients who came to see me initially. She had complications because she had strep throat. She had an ear infection on top of getting COVID. And this was very early. This was in March. She had actually been in a hospital to pick up a relative, and that's where she thinks she contracted it. So no one else in her family. Now, she's one adult in there. There's 3 adults in that house and 4 to 5 kids. No one else contracted it. No one else, just her. And I treated her. And at the time, there was no testing. I said, I think this is what it is, but we don't have any tests. I did send her to try to get some testing done. But at the time, there was no test. So
impossible. Yeah.
Impossible. But she did fine. I mean, I just called her and checked on her just like I do every other patient. And that's really where it is. Now, she did have some early signs of myocarditis. That's kind of what made me nervous about her, because she would tell me if I lay back, it hurts. If I lay forward, it's relieved, which is kind of a sign that there's fluid around the heart. Or fluid in the lungs. So I just told her, try to sit up, try to move, take a walk outside. It was beautiful. I'm like, go outside, go take a little walk. Not a big deal. So that was my first patient, my first treatment. No diagnosis, no testing diagnosis. And she's fine.
And I just want to paint the picture. At that time, the tests were really hard to get. You had, at least in Missouri, you had to go through the state health department if you wanted to request a test. And they weren't testing for the right things, because they said, we'll test for one. And if they're positive for like influenza, we're not going to test for COVID too. It's only, you can only have one virus, apparently. They're really smart. And in New York, when I went out there, it would take them 15, 20, 30 minutes on the phone with the health department to request one test. And they were inundated with patients. Like, nobody has time for that.
No. It's a clinical diagnosis. I mean, you and I both know this. When you're a physician, 90% of what you do is take a history, take those symptoms, match them together in your brain. Remember, we have a brain, and you use your clinical acumen to get as close to what you think is going on, and then you start treating. I mean, this is just medicine 101, really. Yeah. And when I heard that people were closing down and wearing full hazmat suits and, all these crazy things, I'm scratching my head going, I'm exposed to viruses multiple times a day, every day. I mean, kids are giant little viral petri dishes. So I was kind of cavalier, because I said, well, I have a pretty good immune system. I'm good. That was where I was at. And so I didn't understand. It really flabbergasted me, the whole mask thing, I just couldn't wrap my brain around it.
Yeah. And that's parlayed forward, then the next major issue. So you're treating everybody that comes through your door. You continue to practice. Yeah. And then the next thing is they're starting to recommend COVID shots for kids. So walk us through that.
Yeah, that was entertaining, right? I mean, I didn't agree with COVID shots even before they even came out. As a matter of fact, I started raising questions back in November of 2020 when, they were rolling them out for medical professionals, which I said, this is really unusual. We shouldn't be doing this, because these people have been exposed so many times if they're in the hospital. And lo and behold, the first deaths from those shots were really our hospital professionals, right? All of our ancillary staff was encouraged, very, very heartily, we should say, into getting these things, and the doctors as well. And, in my head, I'm like, okay, if you already had COVID, you have your natural immunity. Like, I remember when COVID came out initially, I said to my entire family, and I know they thought I was nuts, and my staff, and I said, you know what? I just want to get it and get it over with. Can I just get it and get it over with so I can have the immunity, so it doesn't block me from doing what I do best, which is take care of my patients, right? Because this nonsense about closing down and all the things was just enough to push me right over the proverbial edge. And so when I'm like, I'm immune. I knew I was immune. In the summer of 20, I was immune. Okay. So then they're telling healthcare professionals, you need to get this shot. And I'm like, okay, I'm a pediatrician. I know that if you get chickenpox, for instance, you never get a chickenpox shot because your natural immunity will always trump anything else that you are trying to do. So natural immunity will always trump any kind of injectable vaccine, period, end of sentence. The only time that may not be true is if you have some kind of immunological disorder or immunocompromise. That's it.
And can I ask you a question? Because I'm not an immunologist, but we've been forced to go down this road.
Right.
If you're immunocompromised, taking a vaccine isn't going to work for you either because you're not going to mount an immune response to that either.
Absolutely. And they're the most vulnerable. So you're like, okay, protect them. So give them something for prevention. Give them something to protect them.
Yeah.
Don't give them something that is a false hope, because we knew early on those shots did not work. And by the time the shots came out, a new strain came out. So it was ineffective anyway. So you're using expired virus over and over again, saying this is safe and effective when it's not safe, nor is it effective. There weren't good studies. The studies that were out were buried. They were horrible. We're just seeing some of the Pfizer data now, but we knew. I mean, I looked at animal studies to do a preparation for testimony in the Texas State Senate in front of the HHS committee. And I told them, I'm like, look at the studies. Not one animal survived an mRNA vaccination study. Not one. Some of them had some hepatitis, which, if you recall, summer of 2021, I believe it was, all of a sudden you started hearing cases of autoimmune hepatitis or some kind of unusual hepatitis in children. And, at that time, I know I just went back to my testimony. I said, this was predicted in animal studies from 2005. This is not new information. The Kawasaki-like disease, again, I knew that was going to happen. Why? Because whenever you have some kind of like giant viral rush, you're going to get that. After 2017, I'm sure, I haven't looked at incidence rates, but I could guarantee you after 2017's pandemic, there were probably cases of it, but we didn't hear about it. It wasn't that important. So now, because what do? You treat it. It's from a virus, so you treat it. Yeah. The hype about this was really overblown. It made us less effectual because we were combating the mis and disinformation that was actually coming through their television sets, because the people that were the talking heads were not clinical physicians that never saw patients. And here we are on the front line.
And comment too, because, the argument's been made and we talk about it. There was never a health emergency in children. And the New York Department of Health has said, we over-exaggerated that because we wanted to encourage you to get the shots for your kids. Now, to me, that's called lying. Yes. And it's unethical. Yes. So can you comment on that? Was there a health emergency? Because they made it seem as though there was.
Absolutely not. I mean, the kids that came in, they were older teenagers that got sick with COVID, that had symptoms, major symptoms. And when I say major symptoms, I'm saying things like it triggered a bronchitis. They were fatigued. Now you're talking about teenagers, right? They eat like garbage. They stay up all night. They didn't have school, so they were messing around, on their phones probably all night long, doing all these crazy things. So, to me, I'm like, they're teenagers. That's what happens. But treatment worked. As a matter of fact, in October of 2019, this strange virus, which I called non-typeable flu, was coming through early, like October, November, which in retrospect probably was COVID. It was hitting the teenagers. I did see a couple of our teenagers that had kind of a prolonged course of the illness, and I was throwing pretty much everything that I described earlier at them. And they recovered, then they were fine. So we didn't have any hospitalizations during that time. We didn't have any problems at that time. But the overwhelming propaganda about the children being a nidus of infection to their grandparents, scaring the children into not wanting to come to school because they thought that they were going to, come home with this invisible, killer known as COVID, and they're going to kill their grandparents or their parents. That is a horrible psychological warfare on children. absolutely horrible. When we knew from Chinese studies that the incidence rate in children was 0.0001%. I mean, it was ridiculous. The children, we knew then, and I kept saying, do not separate children from adults. Children are the buffer. Why are children buffers? Well, because they catch every virus on the planet. Coronavirus, different strains that are not COVID-19, inferred immunity. So if you had a little kid who had a bunch of colds, I would tell them, go hug on grandma and granddad, because you know what? You're actually protecting them. You are not going to hurt your grandparents. The isolation hurt the grandparents. The isolation hurt the kids. We now have something that I have dubbed social autism, because we have kids that were born during that era that only saw people behind masks during a very, very important developmental time for speech and for personalization, socialization. And so now we have these kids nowadays that don't even know how to say hello and goodbye, and don't know how to say please and thank you, and just give you this weird stare if you actually address them. And it's not through and if it's through an electronic device, they can survive, but they cannot survive person-to-person, face-to-face interactions. They just fall apart right in front of you. They hide behind mom. They do all these unusual, I mean, kids will do some of that when they're young, but I'm talking about older kids, school-age kids. And this just doesn't make sense to me. And I knew it was going to happen. I dubbed social autism, I don't know, 3-4 years ago. And sure enough, I said, this is going to come to pass. And I'm seeing it. I'm seeing it in my practice now. We have a shortage of therapists. And, you know, basically what I tell the parents is just try to socialize your kid as much as possible, remove the electronic devices. But this is all kind of that snowball effect of what was happening. We have less healthcare workers in the workplace because some were fired, some were censored, some were sidelined. That's PTSD. They don't want to go back to work in that kind of ugly environment. And who would? Who would? I mean, I know you were. You could speak to that. Totally.
I know. Yeah.
Yeah. I mean, that's kind of the issue. I think the independent doctors, this kind of was, you know, I have my little theories, but the independent doctors that actually have clinical acumen and have experience of these things over the years did much, much better during COVID than those that were, you know, employed by hospital systems, came out in the, out of residencies, probably in the late 90s. They just didn't know how to cope. And that was it's been a really bad thing for medicine. And on one hand, on the other hand, you know, I always said the cream rises to the top. And so people like us, you know, the James Clinic is phenomenal. You guys are just innovative. You know, you treat patients so differently. I've been dubbed the functional, integrative, holistic pediatrician for years. And I honestly
you were
didn't.
functional before functional wasn't cool. Like you've been doing.
I didn't even know what it meant.
Yeah.
Yeah. I had no idea what function. People would come in. Oh, you're that functional pediatrician, and I was like, sure. I don't even know what that means.
I'm functioning today.
Yeah. I was like, doesn't everyone do this? I don't understand. So, you know, that's kind of. But the beauty of it is now people are seeking people like us out, which is amazing.
Yeah. And I just had Dr. Catherine Welch on, and we were talking. You know, a lot of parents are like, well, I'll go through the system for my pediatrician. And then when I really hit a rough spot, I'll get the functional integrative. Yeah. It's like, no, that's really an essential piece that you need to have from the beginning. It's super hard to find. But if you can find it, hang on to it with everything you've got, because it'll change the trajectory of your child's life.
Absolutely. Absolutely. Yeah. And, you know, we have to start from the ground zero. And this is some of the things that happens in pediatrics, you know, which I thought was just, you know, this is how pediatrics works, right? And didn't realize that I was so different than other people, because I actually thought outside the box, and I do things, again, like I thought was common and common sense. Mm-hmm. But my mantra ever since I started my practice was, if you restore the core, everything else is going to work its way out. So, you know, I've always focused on gut health, literally always. Since I opened my practice, I've carried probiotics in my office, and that was 21 years ago. So, you know, these are things that we just, you know, I just thought people did, and I didn't realize that we didn't do it, because yes, I did not get that training in my pediatric residency, but I still learned, you know, I still sought knowledge. I still sought innovative different technologies. And so I think that's what it is. You just have to have an open mind to that. Just because you went to med school, that's not the only education out there. As a matter of fact, that's a thimble compared to what you're going to see in the real world.
Yeah, for sure. So you talked about social autism, and I want to pivot to actual autism for just a minute. One of the things we've talked about on a couple of occasions is the rate of autism in your practice compared to normal. Can you elaborate on that and tell us some of the things that you believe or have seen potentially are igniting that epidemic in our country?
Absolutely. The numbers that when I was in med school, I think it was 1 in 10,000 or something like that, or at least those were the numbers that they said. So there's a couple of factors when you fast forward 30 years, then now it's like 1 in 85. Well, if I look back and I look at my entire practice, I can tell you that there's only a handful of kids that have autism that were my babies from birth. Okay. And I have very specific reasoning that I think this happened to these few kids, right? One kid at 2 weeks of age, I knew there was something wrong. So this is before the child had any vaccines. I think it had to do with maternal medication that kind of altered this child. Okay. So that's one. I probably have less than 10 total. Another kid who was, from 2000 forward, had COVID as an infant. Okay, the whole family got COVID. The baby had COVID. I was treating the baby throughout. The baby did not get very many vaccinations during that time, obviously, because I do not vaccinate a sick child, period, end of sentence. And I told the parents, we're going to wait until the baby's better, whatever. So that child was, I think, 4 months old when he got COVID, if I'm not mistaken, somewhere around there, 4 to 6 months. So, but he's not typical either. He's a very atypical child. He's nonverbal, but he's very cognitively aware. He's very, he just doesn't speak. So, he's kind of on that one little spectrum. The other kids in between have various things that went on. But by calculation, if I calculate how many patients that I have seen over the years and how many vaccinations I've given over the years, I should have well over 800 kids with some sort of autism. And I don't.
You have less than 10.
10. Yeah. If that.
So what are strategies that you take now or used to take that you think contribute to what you're seeing? I mean, other than just the functional approach, but are you doing something different with vaccines?
Mm-hmm. So before 2020 happened, okay, I always paid attention to things like you don't bring in a new vaccine under 5 years. So if something was introduced to the market, I always we know this. You just don't bring it into your practice for 5 years. No matter what the drug rep says, no matter what the company says, my policy was I do not bring it in for at least 5 years, and I follow the safety data. So that's number one, okay? So even if COVID was something that was recommended for children, which it was at one point, I said,
it still is.
It's right? New. In some places it's been banned, so which is awesome. Some places it's completely banned. But I never brought it in, so I wouldn't bring it in because it doesn't fit my rule of thumb, which is you wait 5 years, you have to follow the safety. Okay, that's number one. Number two is I do not buy vaccine that has preservatives in it. So I always buy preservative-free vaccine for my patient population. I have done that for 30 years. Okay. It was just a choice. It is more expensive to do that. But it was just my choice. That's what I chose to do. I'm like, well, it's preservative-free. Let's just go with that. So I think the preservatives and some of the vaccines really do play a role. Okay. Because that's kind of one of the major differences between my practice and when I speak across the country to other pediatricians, and I ask them their what vaccines they carry, if they carry any, and I literally had one very, very famous pediatrician tell me that he did not believe there was such a thing, and he writes books about vaccine and vaccine injury, and I was like, okay,
I've been ordering it for 20 years.
Yeah, I'm like, you're wrong. Okay. So that was one of the things. Now, I'm not saying that his data is incorrect or it's not, but he came from a state that kind of follows a Medicaid mantra, which is the state distributes the vaccine. The doctors have no choice in what vaccine they choose because the state actually pays for it for them. Okay. So that's another huge difference. The third difference is all of my patients were highly, highly recommended to be on a feeding schedule so they don't overeat, they don't feed too early. And I really encourage moms not to buy baby food. Make your own food as much as you possibly can. And the fourth thing I tell them to do is, depending on their prenatal course or their delivery, I do recommend early probiotics. Okay. I've done this forever. This is something I've done for a really long time. I learned the hard way with my own daughter who had horrible reflux. Once I started her on probiotics, the world changed. It was a completely different world after that. So I rarely have a child on any kind of reflux medication. I just, we go through maternal diet. There's just, again, I think this is common sense because this is what I've been doing forever. But what I find is these mamas will come to us and they'll tell me, well, my doctor said the reflux was because the baby doesn't like my milk. Literally, I can't tell you how many times I've heard that, which is the most ridiculous statement I've ever heard in my life, because a mother's milk is the best thing for that child. Why don't we look at mom's diet? Did they ever ask you about your diet? And they say no. No one ever told me to look at my diet. This is pretty simple.
So what are the problems with mom's diet then? What are the things that if someone's out there right now and having trouble with this, what do they pull out or add in?
So the first thing is just keep a food diary. You're exhausted, you're tired, you don't sleep at night, that kid wakes you up all the time. So the first thing to look at is, when is your baby fussy? If your baby's having reflux or is fussy, when does this happen? Is it in the morning? Is it in the evening? And match that to what you ate. And so if you, like, caffeine is one, right? And I'll tell the moms, look, if you had one cup of coffee all through pregnancy, I don't think that's going to be a big deal, right? But when they're up all night, they may be upping that to 2 cups or 3 cups, and then they wonder why their baby's fussy. So caffeine's probably number one, just super easy just to analyze. The second thing is either dairy or gluten or wheat products. So it could be the food or it could be the volume of the food, okay? So I always tell them to look and see, what day was your baby great? What did you eat that day? And what day was your baby a nightmare? And analyze backwards. So, one piece of toast may be fine, but having, a sandwich and then pasta that night, that kid's going to go over the edge, right? Same thing with dairy. So that's kind of how I start, just super simple. And then it can get a little more complicated. Like in my case with my oldest daughter, it was oranges. Oranges? She was born in January. The only fruit really available in the wintertime is citrus. And apparently she really didn't like it because she would hit the wall with vomit. So I learned really quickly, don't eat citrus. And she was fine. So
that seems, you make a point. Common sense isn't common anymore because we've taken thinking out of medicine. And you said, we have brains and we can think, but obviously somebody doesn't think so because they're trying to make medicine AI. And I just saw a law that AI will be able to prescribe. This is actually being posed, and I don't know where. I can't even begin to think. We as physicians have so much accountability to our medical boards and things like that. I don't even know how we're ready to introduce this into the conversation.
This is a horrible idea, frankly. And I really think, honestly, this may be because of supportive staff. We have a lot of mid-levels that don't have the experience, do not have the training. And in some states, they're allowed to train independently of physicians. And so that goes into a whole nother, can of worms about scope of practice. You make a computer do the same job as what we trained for decades to do. Where's the accuracy in it? Who's checking it? And what if there's a bad outcome? Like, who's responsible for that bad outcome? Because I can tell you, if someone in my practice took that advice and had a bad outcome, I would not be very pleased, and I don't think the family would be pleased. But, now you're totally removing liability. You're totally removing responsibility. That is so unethical. I don't even want to get into the whole ethics of the situation, which of course was blown away the last 5 years or so. But, this whole thing is just going, everyone thinks they could be a doctor. Dr. Google, there's a joke, we always talk about, you might not want to refer to Dr. Google and come and see us first. Now, we are human. We are not infallible, but we do know where to find research. We do know how to discern research. AI does not discern anything. It just is a parrot for what it can find. So if you have some bad stuff out there, which we all know there's some really bad studies out there. I mean, it blows us away. We don't even know what's going on. All of us in our realm look at studies and we all go, I don't even know if I should believe this or not. Right? I mean, we're analyzing stuff and we're going, this doesn't sound like it's even a good study. I mean, I saw a report. Look at the measles reporting. The measles reporting is flat out ridiculous in Texas. When I say ridiculous, I mean ridiculous. Because they're trying to say that back in 2020, there was a 0 incidence of measles. And I just looked it up on our U.S. statistics, and it wasn't 0. It's not been 0 since 2020. There has been cases, tens to, in 2020, guess how many cases were in the United States in 2020? Let's just throw that out there. Have any idea? Over 1,200 cases of measles in the United States. In 2020, did we hear of any measles cases in the United States?
Not that I recall.
Okay. So this is what drives me cuckoo, right? Because, bless you, because even less than 5 years ago, we had 1,200 cases of measles in the United States. And people were isolated. They were isolated. There were lockdowns. How did 1,200 people get measles?
Well,
has anyone even thought about it?
And conspiracy theorists.
Right. So, and they're trying to say in Gaines County, Texas, which is where this outbreak is that they're going ape over, that there's a vaccination rate of 87%. And they're saying that's not good enough for herd immunity. It has to be 95%. What they fail to tell you is that two adults started this. 2 adults. So unvaccinated adults, so they say. The problem is it's not a lifelong immunity, even if you get the shots. I can't tell you how many moms come into my office that are pregnant and said, we just got our titers done and it looks like I'm not immune. They want me to get another MMR. And I'm like, bad idea in pregnancy because it's a live viral vaccine. And number 2, did you get vaccinated when you were a kid? And the answer is yes. So really, if that's the case, then we have to really blow this up and go backwards. Sometimes you have to slow down to speed up. And I think RFK Jr. really is on the right track to seriously look at the studies, seriously have us take just a step back. Why do we have so many shots? Why is hepatitis B given to a baby of a mom who's hepatitis B negative? Like that in itself, when I first started training, we didn't give hepatitis B out to babies. We never did that, but now it's like these parents are forced to do it. And I don't even know where to start with that conversation. I just tell them, look, if you're hepatitis B negative, it's not necessary. Just tell them you'll catch it up later when you go to the pediatrician's office. I mean, that's the best advice I could tell them. Because honestly, I had those same concerns years ago when I went to Pfizer's headquarters. Actually,
you did.
No, it wasn't Pfizer. I'm sorry. It was GlaxoSmithKline. It's GlaxoSmithKline. I raised those concerns. Like, we are giving extra hepatitis B because of your sequence here. And they basically blew it off saying the insurance will pay for it. And I'm like, the insurance is not my issue. Why are we doing this? Like, what is the incidence of hepatitis B? Yeah. So this is where I've gone. This is the rabbit hole I've been traveling down lately, is finding the incidence of the disease that we are vaccinating against. And tetanus is quite surprising, actually. The incidence rate of tetanus is pretty non-existent. And yet we're still doing this, and we're still telling people that there's this high risk.
Well, I just got a call from Virginia, in West Virginia, in the flooding, and they said, we need tetanus shots. And I said, okay, but it's not going to prevent you from getting tetanus. Like, that's
Correct.
not what it does. So there's no emergency to that. So it's so ingrained in the fabric of what people do that, and I'm like, I understand you don't want to have this conversation while people are missing and you're in floods.
Right.
However, that's not going to go to the top of my priority list, spending thousands of dollars to get you something that's not going to help.
And something they can get from they should be getting that from their state health department anyway. They shouldn't be calling private sources on that. That's inappropriate, because the health departments are there to monitor incidents and frequencies and numbers and make sure that, to contain things. So, of course, me being who I am, I would have asked, what's the incidence of tetanus going on right now in West Virginia? Right? Because when we're talking about disease, the public health departments are just useless at this point. Yes. Because that simple question that I just asked you, they can't answer.
Well, it's zero. Nobody has tetanus. They're just worried and said, if you cut yourself, you're supposed to get a tetanus shot, right? So they just want to be ahead of this curve, and misguided. Can we pivot topics for a minute? Because I think this is where I want to go. There are so many parents out there who are struggling with difficult children, behavior issues, OCD, ADHD, things like that. And I want to kind of sort out how a parent is supposed to know, or how you work through the process. Is this kid just a turd? Like, are they just naughty? Are they just misbehaving and they need discipline? Versus, do they have an underlying on the spectrum ADHD, like something really wrong? Versus, is this something like pandas? So when you see a child, how do you start to break that down? And can we give parents some guidance on where they may fall and what hope they may have for improvement?
Yeah. So it always starts from the beginning. And when I mean that is, you got to watch your food. Okay. The television set is your hugest nemesis, because they market directly to children, which technically is unethical and illegal. Okay. But if you look at, the cereal commercials, if you look at, even the toy commercials and sometimes books, one of my pet peeves is, when you see books for small children, like counting books, and they're using Jolly Ranchers as their base of the book, that drives me absolutely nuts, right? I mean, it used to be chocolate chip cookies with the Cookie Monster, and that's okay because he's the Cookie Monster, right? But now you have these corporations marketing on books, on teaching kids how to count Jolly Ranchers. That's a problem, okay? So I always tell people, number one, restore the core, right? Here we go. Restore the core. Pay attention to what you're putting in your child's body, okay? Get the dyes out of their system. Try to pump up the protein. I would have to say a good portion of our patient population, not my patient population, but the children's pediatric population, is protein poor, very protein poor. They're carboholics. So again, simple sugars, the glutens, you really have to pay attention to this. If you're going to use natural sugars like fruits, pair it with a green vegetable so you have the fiber and the sugar together. It's, again, this is just good dietary ideals. Because when we were growing up, or at least when I was growing up, right, we had a meat, a vegetable, and if we had dessert, because I did not come from a wealthy family, if we had dessert, it usually was a fruit. So I already had that pairing, okay? And that is just, again, I thought it was common sense, but this is, we're growing up, and now we're having this generation of parents who grew up on McDonald's and Taco Bell, right? They have no idea what a home-cooked meal is. They know Hello Fresh, and they think that is a home-cooked meal. Well, I mean, it's better, maybe. I don't know. But this is kind of my point, is that we're not paying attention to what we're putting into our children. So number one, if we eliminate the simple sugars and the dyes out of their diet, increase their protein, behavior generally changes. It really does. I've seen kids completely 180. Okay, so that's the first thing. The second thing is discipline. Children love structure. I can't begin to tell you this. Children absolutely need structure. They need to know what your top 5 I'm going to get in big troubles are. Okay. So the parents need to line this out to kids. You don't hit your brother, you don't hit the dog, you don't hit mom or dad. That's 4 right there. Okay. And then the other one is safety. Then you start doing that. And those are the things you got to put your kid in timeout. You got to give them a chill out period. You got to let them have some, introspection to what they did. And that actually really is amazing, because at times I have parents report, I've been doing lots of, we've been doing timeout appropriately. Don't go crazy, but appropriately. And, every once in a while I'll walk by and that kid is sitting in a timeout chair. I said, well, that's called self-regulation. The child caught themselves hitting the dog or something and went to sit in the chair. And that's an awesome thing. That means your kid knows that they did something wrong and is trying to make up for it right there and is self-regulating. That is perfect. That's that. And then number 3, get rid of electronic devices in your home. Absolutely. I cannot stand these things. You know how I love electronics, right? They are the worst. They are the devil. I hate electronic devices. So, I cannot tell you how many times I walk into a 6-month-old well child check and the mom's playing Miss Rachel on her phone this far away from the baby's face. Totally a very bad idea. Not that Miss Rachel's a bad person. I'm not saying that at all. She has some really awesome things. But it is inappropriate for a 6-month-old to be watching a screen that's throwing blue light at them and is actually now starting to get into an algorithm to train you in a different avenue. This is super scary stuff. Okay. The kids are now being chased by AI using algorithms to target them. Super young. I see kids with phones as young as 8 or 9 years old. And the excuse is, well, we're divorced and I want them to be able to reach me. That just, the parent has a phone. The child goes to school. The school has phones. I am totally 100% applauding. I think it's Louisiana has a no phone policy now in their schools. And I think that's amazing. And I think that needs to go across the board. Children should not have phones in schools. There is no reason for them. I mean, the stuff that goes on in our schools because of cell phones, the out of control disciplinary practices and stuff like that. I mean, that's just part of it, right? But it rewires their brain. Elon Musk talks about this all the time. Steve Jobs would not allow his children to go on the internet. Steve Jobs would not let his kids have a cell phone. That speaks volumes. He's the man that invented the cell phone, the smartphone. So there's that, right? So those are just, read to your children every night. Reading is so, so important. Even as they get older, I think it's really important. If we come across kind of a cool article, we hand it to our teenager and we're like, hey, just take a look at this. Read it. It's in black and white. It's literally in a magazine. I'm very big on that. So we don't have a TV in our office at all. I have no TVs in my office, which I think is pretty cool. The kids are playing with blocks and on little slides and pretend, we have lots of little things that they can pretend on. And that's what spurs originality, creativity. It makes the brain process better, is letting them play. Too many of our kids are not playing. Getting outside and exercise is the next one, right? Get outside. Let your kid play. It's huge. Let them play and actually get hurt. Let them get dirty. Do not rush over to them because, they stubbed a toe. It's going to be okay. You have to give them life experience. If we have kids in bubbles now, and that's really bad too. So that's part of social autism, right? The helicopter parent. And that also comes into play when we're talking about that. So those are like 5 main tips, right? Yeah. Clean up their diet, get them off the electronic devices, let them play and get outside. Very important. Have a discipline course. And then what was my other? And I can't remember my other one, which was just
no
cell phones. Yeah. No electronics. Yeah.
So if you have a little kid, so if you have a kid 5 and under, 8 and under, should we really be back in like the 1970s with building blocks and Lincoln Logs and things they can touch? And, is that where we should be going with toys?
Okay. Do you remember the little lace? You remember the cards and you used to lace them like you were sewing?
Yes.
That is a huge processing play that is necessary. Legos, processing. It's crossing. It has both sides of the brain meshing. Huge things. Yeah. Blocks are great. because of creativity. Play pretend. Okay. That's great. Kids don't do this anymore. They don't play charades. They don't play. They don't need to be in an organized sport. They need to play an experience. And one of the things that upsets me is that we even have playgrounds now that are modifying the playground to be more sensory integrative because we have all these kids that have issues with sensory. Well, it's because, and then on top of that, they take away some of the playground materials that they feel are too dangerous. Like, guys, look what you're doing. You don't even know what you're doing. This is the thing that kills me. Like those merry-go-rounds, right? Those death merry-go-rounds. I mean, you're not a kid unless you've experienced a merry-go-round at the playground where you fly off and you learn about centripetal force, right? I mean, this is huge.
Yes.
So, I think that's what Elon Musk is actually alluding to, is that we don't have kids that know anything about physics. You learn physics as a small child and you don't even know that you're learning physics. You learn about Newton's law and how when you fall, it hurts. These are things that you need to learn. Mm-hmm. And we've eliminated that. I just, I mean, some of the stuff we played on when we were kids were probably death traps, but you
remember the monkey bars?
We survived. Oh, do I know about the monkey bars? Yes.
I mean, we were upside down hanging off the monkey bars the entire
climbing on the top.
Yeah.
Going backwards, trying to do it backwards,
It's amazing we didn't get brain injuries.
Truly. But this is exactly what I'm trying to explain to people. Is like, let your kid be a kid. Let your kid experience.
All right. We could talk all day and we're already coming to the end of our time. So, as you can tell, we're good friends. Angie comes and sees patients at our office here in St. Louis. She does pediatric consults for us. You have your own practice in Houston, Texas. Tell people where they can find you. Where can they follow you? Where can they get more of this amazing advice?
So we are at A Brighter Tomorrow Family Health and Wellness because we're not just peds anymore. You could find me on social media, although I'm not a big social media buff. I told you I'm not an electronics girl. At Angie Farella, MD, or at Angie Farella, or at A Brighter Tomorrow Pediatrics. I wonder why I have so many social media handles. I just got a Meta Community Standards notification, so one of my pages is frozen. Right. That's kind of what I thought, right? Yeah. So that's where you could find us. I mean, we're around. I do some talking around the country. I'm not really scheduled for anything real soon, but I do a lot of local stuff here in the Houston area. So, just keep your eye out on social media. A lot of women's groups ask me to come speak for them. So that's what I've been doing lately.
Wonderful. Well, Dr. Farella, it's always a pleasure to have you, and we'll keep conquering the world. Thank you very much for being here. Yeah. Thanks for tuning in to another episode of Uncensored Truth in Medicine. We will catch you next time.